Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to Dr. Ozello's Sports Medicine Report. Today I'm going to cover stretching the piriformis muscle. This is a very important muscle to stretch. The piriformis muscle originates on the anterior aspect of the sacrum. The sacrum is this triangular shaped bone right here. It originates right down here. The anterior part of this bone runs across the gluteal region and attaches at the very superior aspect of what is called the greater trochanter of the femur. When the piriformis muscle contracts concentrically, concentric contractions are the positive contraction of the muscle. When the piriformis muscle contracts concentrically, it performs external rotation of the thigh. External rotation is also known as lateral rotation. That means that the thigh is being turned outwards. Stretching the piriformis muscle is very important. When the piriformis muscle becomes hypertonic, which is a state of being too tight, it can press down on the sciatic nerve. The sciatic nerve runs directly underneath the piriformis muscle. If there is pressure on the sciatic nerve, it could cause pain or symptoms down through the entire leg. The sciatic nerve is the longest and thickest nerve in the entire body. It has branches that go down all the way into the feet. If there is an impingement on the sciatic nerve, this condition is called Piriformis Syndrome. If there is a condition on the sciatic nerve, it can lead to sharp-shooting shock-like pain, numbness, tingling, burning, weakness, fatigue, a wide variety of symptoms throughout the entire leg. This is a very painful and performance-limiting condition. Correctly stretching the piriformis muscle can help in the prevention and rehabilitation of piriformis syndrome. The general rules when you are stretching apply to this muscle. Move into a stretch slowly. Hold a mild, comfortable stretch anywhere from 5 seconds to 120 seconds. I think the optimum time is between 30 and 60 seconds, but you have to perform a stretch that for the amount of time that works for you. There is some literature that says to hold it for 5 seconds, some literature that says to hold it for even greater than 120 seconds. Use the time frames that work best for you. But again, move into the stretch slowly. Hold a mild, comfortable stretch, and then move out of the stretch slowly. If any stretch or exercise elicits symptoms or intensifies symptoms, stop that stretch immediately. Find a viable alternative that stretches the muscle but does not elicit symptoms or intensify symptoms. Stretching is not a flexibility contest. You are trying to stretch, to hold a mild, comfortable stretch to reduce muscle tension in the piriformis muscle. You are not training to be a contortionist. You are not training to be a circus performer. You are stretching to hold a mild, comfortable stretch to decrease muscle tension in the piriformis muscle. Please work at your current level. Do not try to stretch or do any type of exercise that you used to be able to do at a younger age or that someone else can do. Again, it is not a flexibility contest. Please start at your current health and fitness level and progress very slowly in small, gradual, calculated increments. The first stretch that I'm going to be demonstrating is the bent knee supine piriformis stretch. I'm going to be demonstrating stretching the right hand side. The left leg stays straight throughout the entire stretch. What you want to do is flex the hip and the knee of the side that you are stretching, place it on the outside aspect of the straight leg, and you're going to keep your spine straight, you're going to keep your pelvis straight, you're going to reach with your hand, and you are going to slowly stretch the piriformis muscle by moving the knee towards the side of the table. You're moving to the stretch slow, hold a mild, comfortable stretch. You want to make sure that you are keeping your shoulders on the table. You don't want to be turning the entire body. Keep the shoulder blades on the table and stretch the piriformis muscle. Again, hold a mild, comfortable stretch and then move out of the stretch slowly. The next one is, again, laying supine. This time I'm going to demonstrate on the left-hand side, and you want to bring the knee towards the chest, grip underneath the part of the thigh close to the knee. You don't want to grip behind the knee, but you want to grip just right above the knee. Pull the knee towards the shoulder on the same side. Once you feel a mild, comfortable stretch, then angle that stretch towards the opposite shoulder. Now this one you may also feel in the gluteus maximus muscle, which is okay, but the main thing you're going to be stretching is the piriformis muscle. So move into the stretch slowly. You don't want to grip like this. Some people will do that. That puts a little bit too much pressure on the knee. You always want to grip underneath the thigh. Again, move into the stretch slowly. Once you feel a mild, comfortable stretch moving towards the shoulder on the same side, then angle the stretch towards the opposite shoulder. Hold a mild, comfortable stretch, and then when you are finished, slowly return to the starting position. Now the next stretch I'm going to demonstrate in the supine position is known as the 4 stretch or the figure 4 stretch. I'm going to be stretching the right hand side. You want to cross the right leg over the left leg, because again I'm stretching the right hand side. The hip becomes externally rotated and flexed, the knee is flexed, and the outside part of the ankle is right above, is on the thigh, right above the knee. So the next thing you do is you bend the knee of the non-working leg. Now some people may feel a stretch in this position already, and that's perfectly fine. Then you just hold this position and you hold the stretch. You always want to make sure it's a mild, comfortable stretch. If this position is too much, then you can always lower the stretch by moving the knee of the non-working leg into a position and moving the hip and the knee into a position where it's not flexed as much. Now what you want to do from here is, if you do not feel a stretch in this position, then you reach under the knee, you grab the back of the thigh just superior to the knee, and you stretch the piriformis by pulling the knee towards your chest. And you will feel a stretch in the piriformis muscle on the leg that is bent like a 4. That's why this is called a figure 4 stretch. And you're going to hold a mild, comfortable stretch. Now in this one, you're not lifting up. You're keeping the head and the shoulders on the table. And you just pull your knee towards your chest and hold a mild, comfortable stretch in the piriformis muscle. The next piriformis stretch I'm going to demonstrate is in a sideline position. You want to be close to the edge of the table. Obviously you want to be safe, you don't want to be too close to the edge, but you want to be close enough where you can stretch the knee over the edge of the table and feel a mild, comfortable stretch right here in the piriformis muscle. So what you want to do is, you're stretching the top, the bottom leg is fairly straight. The top leg, you're going to place your foot behind the knee. You're going to keep your spine straight. Don't flex the neck. Don't let the neck hang down. If you have a pillow that you can use to keep your neck in a good position, that's fine. If not, put your hand underneath your neck. And then what you're going to do is just let the knee fall down. Let gravity pull your knee down, and you will feel a mild, comfortable stretch in the piriformis muscle. If this position is not quite working, you could straighten the leg and let the entire leg fall down. In this one, you want to make sure that the hip is close to 90 degrees. Doesn't have to be exactly, but you want it to be close to 90 degrees. You don't want it to be the hip. You don't want the hip to be in this position down here, because then you stretch different muscles. So try to keep the hip at about 90 degrees of flexion. And again, just let the leg fall down and hold a mild, comfortable stretch. If you need to, you can use one hand to push the knee down, or if you have a pillow and your neck is supported, you could use both hands, but you don't want to push too hard, just a mild stretch. And when you push, you don't want to push on the knee joint. You want to be a little bit above the knee joint. And again, move into the stretch slowly. Hold a mild, comfortable stretch, anywhere from 5 seconds to 120 seconds. Then move out of the stretch slowly, and then perform on the opposite side. The final position that I'm going to go over for stretching the piriformis muscle is in the seated position. When you are in the seated position, just like any of the other stretches, you want to perform this on both sides. I always recommend that you perform the tighter side first. And if there is one side that's much tighter, you can do this one a couple times compared to the opposite side, but you always want to stretch both sides. You want to be seated in good posture. I'm going to demonstrate by stretching the left-hand side. So I'm going to bring the left leg. This is a very similar position to what we did when we were laying supine, when we did the figure 4 stretch. I'm going to bring the left leg, so I'm going to flex the hip, externally rotate the hip, bend the knee, and have the outside part of the ankle resting on my thigh, just superior to the knee. So what we're going to do here, now first of all, if you feel a stretch in this position, then just hold that stretch in this position. Hold a mild, comfortable stretch. If you need to, you can bring the leg up a little bit by flexing the calf muscles, and that will increase the stretch. Or you can place your foot on a little footstool. Just make sure that it's sturdy, and that will help to increase the stretch. Now from this position, you can do this 2 different ways. I'm going to demonstrate one way that directly targets the piriformis muscle first. What you're doing on this one is you're hinging at the hips. You start to bend forward at the hips, and you will feel a stretch directly in the piriformis muscle. Hold a mild, comfortable stretch from 5 to 120 seconds, and then move out of the stretch slowly. Now the other technique I'm going to demonstrate on the right-hand side. This one brings more spine into motion. The starting posture is exactly the same. You want to cross the right leg over the left leg. You're going to externally rotate the hip, flex the hip, bend the knee, and place the outside portion of the ankle just superior to the knee. Place it on the anterior thigh. You're going to sit up straight. This is the starting position. Then you're going to slowly flex the neck and curl the spine downwards as far as you can. Now you'll start to feel a stretch in the spine, and as you get down lower, then you will start to feel it in the piriformis muscle. Thank you for watching today's episode of Dr. Ozello Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, to get additional information on my book, and you can also visit my website to see my blog. My blog contains articles on sports medicine, spine health, health, and fitness. Please feel free to like this video. Please feel free to leave any questions, feedback, or suggestions in the comments section below. Also, please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you are watching this video, you are on my YouTube page. Thank you very much for watching today's episode of Dr. Ozello Sports Medicine Report. Always remember, train hard, train smart, get adequate rest between training sessions, utilize nutritional strategies and supplementation strategies that work for you, stay injury-free, and accomplish your goals.